Winning Wednesday. Very soon, this will make sense to you. All of our class today is going to help push you further into a position of being ready for your licensure examination. Hi, everyone. My name is Professor Regina Callion, MSN. I went back and got the master's. Do you know how you just do levels in nursing? And so I would encourage anyone doesn't matter if you're a RN or LPN, if you want to specialize in a certain discipline of nursing, there's so many routes you can take. I went back and got a master's in education because I knew that I wanted to just get better and better and better with my teaching and my writings. And so I'm encouraging you all today. After NCLEX, what's the next step? So I like to call this educational series. This is one of the things I developed. It's called Winning Wednesday. Yep, today. And we are going to be looking at the very important topic of arterial blood gases. And so I'm welcoming you from everywhere. I really want to know, how is your Wednesday going? On a scale, look, here's our nursing assessment, everyone. On a scale from 0 to 10, how is your Wednesday? How is it? Is it a 5? Or is it an 8? Is it a 10? Is it a 10? If you are in the 8 or above group, look, it's going very well. It's a 10 for me today because I was able to accomplish a lot of things. Everything on my schedule I was able to do, including show up for class. So I see the numbers. I see you. We're going to get into it. But first, as I grab my stuff, making all that noise, I am in the process of helping a lot of repeat test takers get back on the right track. And so I wanted to, where do I see it? I wanted to talk about if your state requires you to have a remediation program before you test again, the ReMar V2 is considered a remediation course in certain states, okay? And this is an affidavit that I have to prove that a student is ready to test again. Some states will block you from taking NCLEX, if you fail. So South Carolina is one of those states. So as we think about what we are going to use to prepare for NCLEX, how we're going to plan it out, I just encourage you all, if you have the V2, that you reach out to me even beforehand, and you can even ask, hey, what are the steps can you certify me for remediation? All right. So if your state is requiring that, I know South Carolina, Minnesota, New Jersey, okay, those states require you to do remediation. And so it's important. It is important for you to know, but I'm happy to help you however way I can. I do need you to be in the V2 though. If you just have quick facts, I cannot certify you to test again. You need to have the full V2 course so that I can go in and just kind of check around, see what you have been doing. And right now for my V2 course, remember always the money back guarantee. We dropped this during RNU, so ReMar Nurse University, but we did implement the money back guarantee for your initial time in the V2 program. Also, I do have, going across the ticker for my nurses that are in Africa, our partnership with Kenya Nurse Consultants. Please reach out to them if you need these books, if you need the V2 course and you are in Africa. All right. For the rest of you, we are getting into it. We're getting into it today with our class. And I need you to get out your Quick Facts book. We're working from Quick Facts, the Next Generation Study Guide. This is something that every nurse needs to have. And we are on what page? Congratulations to all of you. If you're passing NCLEX, please send me a private message because I really want to bring you on to the broadcast to just recognize you so that you can tell your story. We love to hear the testimonials. You can tell your story and encourage your fellow classmates who are next. I know I have some of you who are testing very soon. Okay, we're going to page number 9 for arterial blood gases. Let's read along. Now, I will say that I am only doing the arterial blood gas information that's in Quick Facts. Arterial blood gas is also in my V2. Okay, it's also in this workbook here. This one here. So that's how important this topic is. So when we talk about are you guys ready? When we are talking about arterial blood gases, when we are reading about this subject, let's just start off looking at what the name. When you see arterial, that means something. But when you see a blood gas, right? Blood gas. What gases are we talking about here? Inside of your blood, there are gases. Put in the comments, that's how we do. Like this video, smash that share button because we are just getting started. Some people don't know that we're studying right now. When we talk about an arterial blood gas, what two gases are we talking about? That's the first question that I have for you. And I want to see, do you know what the two gases are? Of course, oxygen. Okay. The second one is what? The second one is carbon dioxide. Good. So those are the two major gases that you are looking for when an ABG is done. Now, is that all that we are looking for? No. If an arterial blood gas is drawn, you're also going to get other elements. But guess what? They support the gas, right? The whole thing is just gases. So oxygen is one. Carbon dioxide is one. The second thing that we will see is going to be the pH of the blood and also the bicarb in the blood. Those two things are also important because they will tell you how that gas is being supported, how that oxygen, how that carbon dioxide, how that's being supported or how that's being excreted through the body. So the pH and the bicarb, those are also important because they balance out the oxygen and the carbon dioxide. Now, let's just go down here and let's read. So the first question that I'm asking you is, where are most samples drawn from? And you have to think about this because in Quick Facts, we are taking ABGs from a skills standpoint. Arterial blood gases in Quick Facts is focused on how this medical procedure should be carried out. And so in nursing school, we learn about our health assessment. And actually, my sister-in-law, she's an LPN. She's just going back to her RN, and she's in health assessment right now. They're using ATI. As part of the ATI competencies, you have to do steps in order of certain skills. You know that. So for an arterial blood gas, I want you to be envisioning in your mind, do I understand the steps? Even if I'm not carrying them out, right? But do I understand what is safe and why it is being done? All right. That's what I want you to think about. So most samples are drawn from, what do I have here? I have most samples are drawn from the radial artery. Now, what's important about that? What's important about the radial artery? All right, here's the thing. We're talking about the radial artery. So the radial artery is important because of its location, but can an ABG ever be drawn from blood? Not from blood, from veins. Yeah. Can you ever do an arterial blood gas through veins? What do you say? Yes or no? Yes or no? The answer would be, of course, no. No, like no, you wouldn't do it. Even in the name denotes where it's coming from. But let me ask you why. Why aren't veins appropriate for arterial blood gases? Why aren't they appropriate? Veins do have blood in them. Veins do have blood in them. What's the problem with the blood in veins though? This is taking you back to anatomy. This is taking you back to your basics. This is probably taking you, listen, this is taking you back to T's and HESI entrance exam, your entrance information, right? So we know that veins typically have deoxygenated blood. So we're not going to be able to get a reading that we want, because we want the blood that's coming from the lungs, right? That has that fresh oxygen in it for our patient. That's what we want to see. So we're not going to use veins ever for an ABG. I want us to get to a point where we know why we're saying the answers that we're saying, because yes, we can say no, but what's the reason why there is a no? Right? That's what we're digging into today. So we're not going to use any veins. It's the radial artery. It's the radial artery that I want you to think about. How long should pressure be applied to the site after collecting a sample? 5 minutes. Now, the next point is very important here. I asked you what needs to be done before an arterial blood gas is taken. This is so important because if an arterial blood gas is not done appropriately, now, have you ever seen one done before? Or if you ever have to do one, because sometimes nurses do have to do them. I've worked in hospitals where respiratory therapy, they're not the best in doing them, or it's a responsibility of the nurse because they don't have a respiratory therapist on site or in the building or anything like that. But if the doctor orders an arterial blood gas, that doctor is not coming to do the arterial blood gas. The nurse who is in charge of the patient, or the nurse who is the most senior, will do an arterial blood gas. So let's talk about what needs to be done before that happens, because if it's not done, the answer is what? Yes, the Allen's test. If the Allen's test is not done and an arterial blood gas is done inappropriately, or there's any complications, the patient can what? Because we're talking about our arteries here, the patient can lose their entire hand, okay, if it's not done appropriately. So the Allen's test is something that I wanted to draw your attention to. When we're talking about the Allen's test, what are we checking for? What are we checking for with the Allen's test? We are checking for the circulation to that hand to be able to withstand an arterial blood gas. The Allen's test is almost for the nurse or the respiratory therapist who's going to do this procedure wrong. And it is just an insurance policy that say if the nurse messes this up, the patient won't lose their hand. Or if the respiratory therapist messes this up, the patient won't lose their hand. What two arteries are we checking for with the Allen's test? Okay. This is a very high level NCLEX question. What two arteries are we checking for? We are checking for the radial and the ulnar. Okay. We're looking at the patency of both of those arteries. Now, let me ask you, which one is important? Which one is the most important in Allen's test? Is it the radial or is it the ulnar? And put this in the comments, because this might be totally new for somebody. I don't know. Maybe you're not familiar with the Allen's test. All right, so this is where I'm going to get out my photo. I showed it to you earlier. So, you know what I'm looking for, and I don't see it. Oh, here it is. Hold on one second. Let me grab this. You know I love a good clipboard. Okay, we're going to do a little review here. Okay. So when you're doing the Allen's test, the first step is we're going to have our patient make a fist, right? And by making a fist, they're going to drain all the blood from their hand out. Like it's going to take away the blood, right? And then remember we talked about when you're doing Allen's test, you're looking at the radio and the ulnar arteries. Those are the two that you are going to evaluate, right? Now, for the arterial blood gas, we know that we are going to stick that needle in the radial artery. That's where we will get our sample from. So why are we checking both arteries here? Why does it matter if we are checking the ulnar artery if we know we're going to use the radio? And let me ask you this, which one do you think is most important? It is the radial artery the most important or the ulnar artery the most important for the Allen's test? What do you think? Let's talk about it. Let's talk about it. So when you do the Allen's test, you tell the patient, ball up your fist, clench your fist, and then you as the nurse, you block both arteries, the radio and the artery. And then to actually do the test, what you're going to do is have the patient open their hand up and you are going to release the radial artery, right? I'm sorry, you're going to release the ulnar artery and hold down the radial artery. Do you see that? Let me explain again. Let me just make sure, right? So you have both arteries blocked here. To actually do Allen's test, you hold down the radial and you let the ulnar go. Okay. So which one is most important to evaluate? The one that's most important to evaluate is the ulnar artery. You want to make sure this one is working. Why? Because if you do an arterial blood gas and you insert a needle into the radial and you blow the radial artery, right? You compromise it. We want to make sure that there is still able to be circulation in that hand from the ulnar artery. But if we do the Allen's test and the ulnar artery is not able to innervate this hand, can we do the arterial blood gas? Can we compromise the radial artery if the ulnar artery is not there to support it? We cannot do it, right? So the Allen's test is to check the patency of the backup system because we would never use the ulnar artery for an arterial blood gas. Why is that? Because it's more difficult to get to, right? So we know that it is there strictly for circulation. However, if there's any problems with the ulnar artery, the ABG is off. Okay, because we know that we will compromise the radial artery to get an arterial blood gas. So we can't rely on it to be functional. We have to make sure that that backup system is in place. This is a huge, huge safety point for NCLEX. Please remember my words. Follow me. Hit the subscribe button. Hit the follow button. Follow me. Never lose me. Never lose me, okay? Because we want to make sure that you are competent, but most importantly, you're safe. And NCLEX is looking to see who's the safe nurse. So now that we know that the Allen's test is focusing on two arteries, all right, then we can move forward, I think, with just the mentality of how I approach arterial blood gases for interpretation. But the physical steps of it, they have to make sense. They have to make sense. So be careful if you're an RN who is going to be doing this test. A quick substitute for an arterial blood gas test would be the pulse oximetry. That will give you the oxygenation of the patient very quickly. All right, so for this, I'm done. I'm done from quick facts. I do just want to look at the information for those of you who don't have V2. What's important for you to know is that there's stuff in quick facts that is not in this book, and then there's stuff in this book that is not in quick facts. So in this book, I go into actually being able to interpret those arterial blood gases. This is very important because NCLEX is looking to see if you can identify life-threatening problems early. we as nurses, we are the last line of defense for our patients, and we are sometimes their only help. Okay. Sometimes their only help. So arterial blood gas interpretation is essential for you to be able to do. Now, I'm speaking to my licensed practical nurses right now. You need to know how to interpret an arterial blood gas for NCLEX. I know your instructors may not go over it. They may not understand it. They may not think it's necessary, but you need to know arterial blood gases. Okay. So if you don't remediate, because that's what you would be doing. If your curriculum did not empower you with the knowledge, you need to remediate in this area. Okay. So it's up to you. I go over two perspectives of arterial blood gas, the interpretation by numbers, and the interpretation by the clinical diagnosis. So this is what the page looks like in the V2 workbook. Okay. So going over the principles of the pH and the bicarb, knowing how to interpret them if you're given a series of numbers. And then also at the bottom here, we go over the interpretation by diagnosis. So if a patient comes in and they had a near drowning accident, what would you expect their arterial blood gas to be, right? Near drowning accident. So we know we're expecting respiratory, what? Acidosis, right? If a patient has cancer, right? Cancer, metabolic acidosis, and it should be anything. It could be literally if a patient has, what, if they need their wisdom teeth pulled, if they need like anything, there is a pH condition, a bicarb condition that will happen because of it. So it's very important for you to be able to determine if there is a lung problem or a kidney problem for your patient. And one of the ways that the lungs and the kidneys speak to us is through arterial blood gases, So it's a competency requirement for you to really focus in on. All right. I won't belabor it, but my goal today was to position arterial blood gases, the skill, and also where you can find the next level of information. And so I can say this. Thank you so much for coming to class. This episode definitely was brought to you by the ReMar V2 program. I'm going to be teaching exclusively out of my curriculum so that you feel empowered as you go through it. If you're following the study calendar, you will get to arterial blood gases. I think study sessions number 9. Arterial blood gases, chest tubes, and congestive heart failures. You can find this study calendar in the file vault. If you need the PDF of it, you can also just contact me. Let me put my email up here for you to see it as well. Study calendar is super essential because it will allow you to have a guide. Where is my email at? Here it is. support@remarreview.com. We do have the team on it, especially if you have any issues with your particular account. I can't get into your account right now, but this is the time for you to make sure that you are aligning yourself up for success. I want you to be testing. This is the time now, August, September, October. This is really that important time to get focused because you know what comes after that makes it really hard for you to pass NCLEX. It's the specific time of year. People tend to get more distracted. People tend to allow NCLEX to slip into the never regions of their mind that they never think about. And that's the holiday season. So we want to make sure that now you understand that most people who don't pass by September, they don't try again. They don't begin to try again until the next year, the next spring. Okay. So I'm trying to do everything I can to keep you focused because that holiday season is a mighty foe for your concentration. Okay. So everybody as well, I will be back on Monday doing Monday motivation, keeping you motivated, keeping you uplifted during the process, and just sticking along with you until you test. So if you need to take the next step, if it needs to be you scheduling your test date, do it. Come on. Do it for yourself. Do it for me. Come back here with a report of a test date. That's what I want to challenge somebody to. Schedule this test. And it could be, you could be scheduling it the end of August, the beginning of September. I don't care. Get a test date scheduled if you can. Okay. If you can't schedule your test, I'm not talking to you. But if you can, schedule that test. Let's schedule it so we can have something that we're working towards. Okay. If you need affidavits, if you need remediation, send an email. So let's get you back on track. Okay. I love you guys so much. And as always, hey, you can, you will, and you must pass NCLEX. See you later.